Hi, my name is Dr. Mike Chapman, and I'm a pediatrician at a pediatric medical group with Texas Children's Pediatrics in Houston, Texas. Another area that's covered in well child checks is screening for different medical problems. And I think of this as starting at the newborn period in the hospital and continuing on as long as the pediatrician's seeing your child. In the hospital, we're doing things like screening for genetic problems like PKU, sickle cell, cystic fibrosis. As the child is getting older, we're screening for anemia, we're screening for lead, we do an autism screen. We'll do different developmental screens as the child's getting older. When they get mid-childhood, sometimes we'll be checking for cholesterol, or as they're getting older, we might check for behavioral health issues like ADD, anxiety, depression. As the children are going and becoming athletes in high school, we're checking for doing heart screenings to make sure your child is healthy to participate in sports. During all these checks, it varies, and it varies with how old your child is. It varies on what kind of things your child are doing. So I think it's really important to have a good continuity of care with your pediatrician. Now, I think of all the well child checks as one long, big well child check. From birth until they go off to college or they, get a job. We're screening for different things at every check, and having a pediatrician that you can go to that has seen your child for a while, I think is really important. Because there's different things that come up as time goes on. It's very important to have that continuity and to know who your child is so we can know what to screen for and be appropriate with it. During the well child checks, I feel like parents have a lot of questions about vaccines. And vaccines are very important, and we do them in quite a few of the well child checks. We start with vaccines actually usually in the hospital with the hepatitis B vaccine. And then the next big set of shots is at 2 months of age. As we go on for the first couple years of life, there's quite a few vaccines at each of the visits. One of the reasons why we do this is we're trying to prevent the diseases that can be prevented. So it's a wonderful opportunity to prevent flu, meningitis, whooping cough, tetanus, polio, and we're even starting to prevent some of the cancers like head and neck cancers and cervical cancers with the HPV vaccine. So your pediatrician will probably recommend vaccines, and they usually recommend it via the CDC schedule. If you want more information about vaccines, you can go to the CDC website. Thank you for the opportunity to take care of your kids at Texas Children's.